there is not going to be a single solution to this. I almost said silver bullet, but I don't actually like that that phrase in the context of healthcare. There's not going to be a single solution to this. It is going to take a multi-pronged approach. It's going to take a combination of continued social distancing for some period of time, almost certainly longer than people are comfortable with. And it may take multiple attempts at social distancing, sort of opening and closing, opening and closing. That's going to be one. It's going to take concerted effort to work on scientifically valid treatments, not what our gut tells us, but using real science to understand what works and what doesn't. And that unfortunately takes time and patience. It's going to take work on a vaccine. It's going to take ramped up testing, and it's going to take a hugely enhanced effort around contact tracing. And any one of those things is a massive effort. You think about combining them all together, that is even bigger, but it's going to take all of those things for us to do it. Now, I actually believe that we have the ability to do these things if we put our mind to it. Mm-hmm. Let's take as an example contact tracing. We've got to ramp that up in a huge way. We've got to ramp that up in ways that other countries that have been more successful at containing this than we have done so. But it will take thousands and thousands of people working at that. Yeah. In the 1930s, the WPA was created, the Work Projects Administration, and they worked on infrastructure. I think we're going to need something similar in this country. It's an economic time that, in fact, may be similar to the 1930s. But instead of a regular infrastructure, we need to work on a public health infrastructure. And if we were to devote ourselves in the way I think that occurred then, we could beat this thing.